From the JAMA Network, this is JAMA Clinical Reviews, interviews and ideas about innovations in medicine, science, and clinical practice. Here's your host.
Welcome to this JAMA Clinical Reviews podcast. I am Dr. David Simel, Associate Editor for JAMA. In this podcast, we will be discussing severe food allergies. To address this topic, we are pleased to be joined from the University of North Carolina by Drs. Yamini Virkud, who is an Associate Professor of Pediatrics, Allergy, and Immunology, and Onyinye Iweala, who is an Assistant Professor in Adult Allergy and Immunology. They are authors of the review on severe food allergies that appears in JAMA in the February 13th, 2024 issue. Drs. Virkud and Iweala, thank you for joining us today.
Thank you for having us.
Thank you.
Let's start from the top and discuss what we mean by severe food allergies.
So when we talk about bad or adverse reactions that you can have to foods, it appears on a spectrum. There are subsets of reactions you can have to foods that we think of as food intolerances. And then there are bad reactions that you can have to food that are driven by your immune system. And when we're thinking about severe food allergies, we're thinking about reactions to foods that are driven by your immune system, and specifically by IgE or immunoglobulin E allergy antibodies. So those particular types of reactions have the potential to be fatal. But I'd like to say from the outset that it's very rare that anyone actually dies from these IgE or immunoglobulin E food allergies.
What would a patient who's having a severe food allergy experience?
If you're a patient experiencing symptoms from a severe food allergy, you would be experiencing things like difficulty breathing, throat tightening sensation, shortness of breath. You may feel dizzy or lightheaded, like you're about to pass out. You may feel very nauseous and start retching or vomiting, and you may have severe abdominal cramping at the same time.
All right, Dr. Virkud, we need food to live. How does a person actually develop a severe food allergy?
Yeah, that's a really interesting question. It's definitely something that we're trying to research and is an area of study. But what we think, as far as the data goes right now, is that what happens is we go through this first phase, which is a sensitization phase. That's where your body learns how to make antibodies, those IgE allergy antibodies, to the foods. We think that sensitization phase probably happens through the skin. So people get exposed to the food via the skin, and it essentially triggers the wrong kind of immune response, where you develop what we call a Th2 immune response. In contrast, if we can beat out that skin response by exposing children to food early through the mouth, then they develop the appropriate oral tolerance that helps them not develop a food allergy. So the kids who don't get that oral exposure early on, and they do get that skin exposure early on, end up becoming sensitized, and then they go into that second phase where they actually develop the allergic reaction and lose that oral tolerance. So they've started to be sensitized at first, then they get exposed to the food, sometimes for the first time, and because they already have those allergy antibodies on board, they react during the first or second time when they have the food.
Does that mean children can't play with their food?
No, please let your children play with your food. So when we talk about exposure by the skin, it's really about what's in your household and what you were eating. And the foods that are in your household get into the dust of your home. And when they get into the dust of your home, they get into all of our skin all over. So it's not the act of playing with our food or the exposure via the palms or the mouth that's sensitizing these children. It's our day-to-day lives where food is in our lives, and therefore it's on our skin. So then we essentially encourage kids to play with their food, because that usually leads them to eating the food earlier on. And that's an important part of getting children to eat the food earlier, develop that healthy oral tolerance, and not develop a food allergy.
Well, what are the most common food allergies in children?
So we talk often about the top 9 food allergies. And so those top 9 are milk and egg, soy and wheat, peanuts and tree nuts, fish and shellfish, and then the latest one that's increasing in prevalence is sesame. But when we think about what's the most common practically in terms of what we see out of those top 9, I would say it's milk and egg, peanuts and tree nuts, and sesame. But the most common kind of depends on whether you're looking at children or adults, because that's what children present with. And we see a lot of milk and egg allergies when children are presenting. However, more people outgrow milk and egg allergies. So that by the time you get to adulthood, the most common allergies end up being things like peanuts and tree nuts. And then you see a rise of shellfish allergies as well.
Dr. Iweala, in your review, you go over the relatively recently recognized allergy to red meat, or alpha-gal syndrome, and you describe it as a food carbohydrate allergy. How would a patient or their clinician suspect this allergy?
That's a fantastic question, because the reality is that it can often take years for people who have this allergy to get a diagnosis. And that's because, in contrast to food protein allergies, when people develop alpha-gal syndrome, this food carbohydrate allergy, they don't develop allergic symptoms until hours after they've ingested the mammalian meat or red meat that actually has the alpha-gal, which is the short way of saying a sugar called galactose alpha-1,3 galactose, which is found in lower mammals. So basically cows, pigs, things with hooves that we like to eat red meat. And so you really do have to have a high index of suspicion to think about this diagnosis. So one of the classic stories that I'll hear in my clinic from a patient where we start thinking about alpha-gal syndrome is that the patient remembers eating a steak or maybe eating a burger, maybe having a little bit of wine or beer. They have it for dinner, and then they wake up in the middle of the night scratching or feeling dizzy, lightheaded, or nauseous, or covered in hives. When you get that type of story, you start to get suspicious that alpha-gal syndrome might be in play. The other thing to keep in mind is the environment that the person lives in. So if you're talking to someone who lives in a heavily wooded area, or maybe they're really active outdoors, like hiking, fishing, hunting, gardening, walking their dog in wooded trails, these are places where people get exposed to ticks. And so one really unique feature of alpha-gal syndrome and the red meat allergy in alpha-gal syndrome is the fact that the sensitization to the carbohydrate, the alpha-gal, is actually associated with exposure to ticks. So if someone comes in describing allergic symptoms and they can't really identify why they're getting these symptoms, but they live in a heavily wooded area where they could have tick exposure, basically you should then ask them about, what did they eat for dinner if they're waking up in the middle of the night? Or if they're experiencing these allergic symptoms, say in the evening time, what did they have for lunch? And you could try to figure out whether or not mammal meat or mammal products are involved. And then the last thing I'll say about this is, interestingly, there is a subset of patients with alpha-gal syndrome who don't actually present with any skin symptoms or itching. Instead, they present only with gastrointestinal symptoms. And so these are patients that will show up primarily to their primary care doctor or maybe a gastroenterologist describing symptoms that sound more like an irritable bowel syndrome. So they have a lot of abdominal cramping and lots of diarrhea. And in this region of the United States, the southeastern United States, the tick that's been associated with the development of alpha-gal syndrome is endemic. And so there are a lot of people who have been exposed to this tick. So frequently, patients who describe those types of symptoms, it makes a lot of sense to check to see whether or not they may have these IgE antibodies against the alpha-gal, because if they're positive, you can recommend taking mammal products and mammalian meat out of the diet. And many of these patients with these IBS or irritable bowel-like symptoms, they actually improve. And so that can be an interesting or unique way in which alpha-gal syndrome can present.
Are these ticks only in the southeastern United States?
They are primarily located here. However, the range of the Lone Star tick in the United States is spreading. And it may be as a result of climate change or spread of the different kinds of animals that the ticks live on. But there are pockets of Lone Star tick moving into the mid-Atlantic as well, in Long Island. It's spreading towards the Midwest as well. But not as much in the southern United States, but in these other areas, so Southeast, Midwest, Mid-Atlantic, you're going to find Lone Star ticks.
Well, as luck would have it, I actually got called by a patient this morning with alpha-gal syndrome. And the patient said, I've got a new restaurant in my neighborhood that I'd like to try. Can I have an egg roll? What are the challenges that a patient with AlphaGal syndrome has to face when they're deciding what they can eat or can't eat?
So basically, you're getting at this idea that there are hidden sources of alpha-gal. Because alpha-gal, this sugar, it can be attached to mammalian proteins, but it can also be attached to mammalian fats or lipids. And so things to look out for are beef broth or gravy drippings, for example, or fat back or bacon and vegetables. So if you have an egg roll, but it's cooked in a mammalian fat or lard, there's a chance that there's alpha-gal in that egg roll. The other place where people often get caught is they say, oh, I know I can't have mammal meat or red meat. I'm sticking to turkey sausage and chicken sausage. But you have to pay attention to what's encasing the sausage because some of the chicken and turkey sausages are actually encased with pork. So that can be another big hidden source. And then in the South in particular, looking out for how vegetables are made because fat back and bacon oftentimes are present in our vegetarian dishes where we are right now.
Does a person with AlphaGal syndrome need to avoid mammalian meat products forever?
That is a little bit of a tricky question. So what I'll say is that there appear to be different subsets of people who get alpha-gal syndrome. There are one set of individuals who, over time, if they avoid tick bites, you can see the alpha-gal allergy antibodies or the IgE antibodies, they decline over time. And in those patients, experts basically feel that if the alpha-gal IgE level gets down to 2, or if it's less than 2% of their total IgE allergy antibody levels, then this would be a good time for the patient to try to reintroduce mammalian meat into the diet. However, there are other patients where they find that the IgE levels, so the alpha-gal, persist. Even when they're doing their best to avoid tick bites and they're doing their best to avoid exposures to mammal meat. We still don't understand why some patients see a decline in their alpha-gal specific IgE levels, while other patients can have persistence in their alpha-gal specific IgE. I mean, one clear risk factor is whether or not you're getting more and more tick bites, because the more tick bites you get, the more likely you are to have a spike in your IgE, and then the more likely you are to have alpha-gal syndrome in the long term. But if you can avoid tick bites, then there's a higher likelihood that your IgE levels will go down, and you may be able to get mammal meat back into your diet. In many patients, it can take years. I've had patients maybe 4 or 5 years later after their diagnosis is when they're able to get mammalian meat back into the diet. And I've had other patients where within 6 to 12 months, their IgE levels have dropped significantly and they've brought meat back into the diet. So it's not impossible to get the meat back into the diet with this condition.
Dr. Virkud, we can't have a conversation about severe food allergy without talking about what we do when our preventive measures fail and a person has a severe anaphylactic reaction. Could you review the steps we should be prepared to take? And actually what the patient should be prepared to do also.
Yes. So one of the things I tell my patients, and I have food allergies myself, I'm never going to get mad at them if they accidentally have an allergic reaction. We try our best, but accidents happen, whether that's because of the waiter, because of family, because of ourselves. I am going to be a little frustrated if they don't have their epinephrine auto-injector. And that's the one thing. So for my patients, I essentially tell them, you are not allowed to eat unless your epinephrine is there, because accidents happen everywhere unexpectedly. And so that's the most important part of treating an allergic reaction, is literally just having the epinephrine available. So we have 2 ways to treat an allergic reaction. For milder symptoms, we have antihistamines like diphenhydramine, cetirizine. With those, the thing to remember is they are comfort medications only. So if somebody has a little bit of hives, a little bit of belly discomfort, they can take the antihistamine, but that's not what you should be rushing to, measure out the diphenhydramine right away. When you start to have those more severe symptoms, like Dr. Iweala spoke about, the trouble breathing, the vomiting more than once, the swelling in your lips or your mouth, that's when you want to be thinking about the epinephrine. When we talk about epinephrine, I tell all our families, if epinephrine is, coming to your mind, you should probably be using it. And so once you're starting to have those more severe symptoms, then you have your epinephrine available. You essentially inject it yourself into your thigh, In the movies, you see people swinging, you see them putting all kinds of places. We don't do that in real life. Epinephrine auto-injector to the thigh, it can go through clothing. If there's no improvement in 5 minutes, then we want to use another dose. A lot of people feel afraid of the epinephrine because they're worried that it's going to do something bad to them. In general, the anaphylaxis is already doing something bad to you. I'm not worried about anything the epinephrine is going to do. And in most people, it's incredibly well tolerated. So what we tell our patients is we want them using it early and often. The earlier you use epinephrine in a reaction, the better chance it has of staving off the more severe symptoms. And then not being afraid to use another one if you need to. We used to say as soon as you use your epinephrine, we want you calling 911 immediately. Some of the guidance around that is starting to loosen because families and adults themselves as well were afraid to go to the emergency room because of COVID or just didn't want to have to deal with the hassle of going to the emergency room. So they weren't treating with their epinephrine, and that actually puts you at more risk. So what we want you doing if you have a severe reaction is to use the epinephrine. And then if it was sort of a soft call, you were starting to cough a lot, but you weren't really sure, was it a potential contamination, or maybe it's some other cause of coughing, or you're starting to throw up and you're not really sure, is it definitely what I ate, or maybe I'm starting to come up with a viral infection. Then please use the epinephrine if it's reasonable that you ate the thing that you're allergic to. But then you can make a call, hey, for the most part, I think I'm doing pretty good. Maybe I can wait on going to the emergency room. However, if you're having severe symptoms, and what I tell my families is if you're at all nervous or scared, I want you calling 911. Or if you are using that second epinephrine, or if you have a patient, who you don't think can understand that kind of nuanced difference, then we want those families calling 911 right away.
Dr. Iweala, is there anything else you would like our listeners to know about severe food allergies?
I just want to echo what Dr. Virkud just said. Epinephrine is the key to treating severe allergic reactions, so don't delay. Go ahead and use it.
Well, thank you, Drs. Virkud and Iweala, for this wonderful discussion today about severe food allergies. This episode was produced by Daniel Musisi at the JAMA Network. To follow this and other JAMA Network podcasts, please visit us online at jamanetworkaudio.com. Thanks for listening.